hi there, dear. Thank you for my prescription. They told me in hospital this pill can be dangerous. I'm scared I'll get it wrong. Do you think you could help me understand?
Of course. So my name is John. I'm one of the pharmacists in the store today. So before we start, could I just check your name and date of birth, please?
Hello, John. I'm Alys Barnard, born on the 12th of April, 1951. Thank you for helping me.
Okay. So I can certainly help you today, Alice. So you said you've been in hospital recently. Are you aware of what diagnosis you came out of hospital with, and what medication they're looking to start you on?
Oh, thank you, John. And it's Alice with I love, not Alice. Don't worry, happens all the time. Yes, I was in hospital a few days ago. They said I've got something called atrial fibrillation, I think it is. Something to do with my heart beating funny. They gave me this new medicine, Warfarin. I'm not sure how you pronounce it. They said it's a blood thinner and that I need regular blood tests, but it's all a bit confusing.
Okay, that's okay. We can walk you through that today, no problem. So you're right in saying it's a medication that thins your blood. When you were in hospital, did they explain how the kind of monitoring of it might work? 'Cause it's a bit different to some normal tablets that you just take on a regular basis.
Well, they did mention something about blood tests, but I have to admit I got a bit muddled with all the information. They said I'd need them often and that it's important to keep the levels right, but I'm really not sure how it all works together. It makes me anxious thinking about the whole process and what might happen if I get it wrong.
Okay. Yeah. So as we said, it's a blood thinner. So we're trying to thin your blood and this is in the context of your atrial fibrillation, which I'll go in and explain as well. Um, but we're aware that when people have atrial fibrillation, their heart beats in a funny rhythm, and that can kind of lead to the risk of clots because your blood's not flowing in a uniform manner. So we try and thin the blood to try and reduce the risk of a clot ever forming. Does that make sense?
Oh, that does help make things clearer, John. Thank you for explaining it in a way that makes sense. So it's really to prevent clots because my heart's not quite beating right, I see now. But with these blood tests, how regular will they be and what exactly do they measure?
Okay, really good question. So we're going to be measuring your blood test on a regular basis, normally kind of weekly to start with, and we're measuring something called your INR, which is the International Normalized Ratio. It essentially just means it's a measure of how thin your blood is and how quickly it clots. And it can then determine what dose of warfarin we give you subsequently.
I see. Thank you for explaining that, dear. So it sounds like I'll need to keep track of these tests and doses, is that right? Having it weekly at first sounds like a lot, but if it's necessary, I'll manage it. Is there a way to remember when to go for these tests and how much medicine to take? I'm worried about keeping it all straight.
Yeah, certainly. That's something we can go through with you today. We can also give you some leaflets, so if anything I've said today isn't recalled, you can kind of read it at a later date. Um, can I just check? So, have you been given any medications when you've left hospital, or are we giving you the prescription today?
They did give me some tablets when I left the hospital, and I was told to start taking them in the evening. But I wanted to make sure I was doing everything right and see if there are any tips on keeping track of it all. A leaflet would be very useful, thank you. Also, I wanted to check if it's all right to keep taking my paracetamol and vitamin D alongside this new medicine.